Many families nowadays are getting more pets as additional family members. Because aside from joy and happiness they bring, they say having a dog or cat reduce stress, anxiety, and depression, ease loneliness, encourage exercise and playfulness, and even improve your cardiovascular health. But how about their health? As a pet parent, apart from providing their basic needs such as food and shelter, health is one of the most important things we need to secure. And by giving them proper hygiene, regular deworming and vaccinations and checkup are the key to protect them from harmful microorganisms. Today we're going to discuss our top 5 killer diseases that your dog can get when forgetting and skipping their vaccinations. Number 5. Canine ehrlichiosis. Canine ehrlichiosis is an infection acquired from tick bites. This disease is more common in tropical or subtropical regions but occurs globally and is transmitted by ticks. Dogs with ehrlichiosis can most commonly have acute fever, decreased food intake, lethargy, petechiation or pinpoint bleeding on the skin and nose bleeding. Lameness, stiffness, and muscle pain are sometimes present. Ehrlichiosis can lead to death due to blood loss and severe anemia if left untreated. Treatment consists of appropriate antibiotics and supportive care and may require months of treatment. Prevention involves protecting dogs from tick bites through consistent application of veterinary-approved tick prevention products and prompt tick removal. Number 4. Leptospirosis. Leptospirosis or lepto is a bacterial disease that can affect both animals and humans. In fact, as of today it is currently the most common zoonotic disease in the world that can be transmitted from animals to people. Dogs and humans that makes contact with still water infected by animal urine is at risk of contracting leptospirosis infection. Leptospirosis can cause your dog multiple uncomfortable symptoms and can lead to organ failure if treated late. Some of the common signs that dog owners noticed are jaundice, vomiting, dark yellow to bloody urine. Similar to other severe diseases, infected patients needs to be in close monitoring at the hospital. It is also very preventable through vaccinations and sanitation. Number 3. Heartworm infection. Heartworm disease is a parasitic infection caused by Diarofilaria immitis, a worm, that is spread by mosquitoes through a bite of an infected mosquito. Heartworm is a serious condition that can cause major damages to your dog's organs. It is known as a silent killer, because in early stages of infection, most dogs show little to no symptoms at all, and the more the disease progresses, the more likely apparent symptoms will develop. Noticeable signs of heartworm disease may include a mild persistent cough, reluctance to exercise, fatigue after moderate activity, decreased appetite, and weight loss. The best treatment for heartworm is prevention. Heartworm disease treatment is not easy on the dog or on the owners. Treatment can be potentially toxic to the dog's body and can cause serious complications, such as life-threatening blood clots to the dog's lungs. Treatment is expensive because it requires multiple visits to the veterinarian, blood tests, x-rays, hospitalization, and a series of injections. That's the reason your veterinarians often recommend that pets must receive heartworm prevention medication all year long. Number 2. Canine distemper. Canine distemper virus is a highly contagious, often fatal viral disease that affects the respiratory, gastrointestinal and nervous system of dogs in all life stages. It is spread through direct contact or airborne exposure, rather like the common cold in humans. Transmission happens when an infected dog or wild animal coughs, sneezes, or barks. He releases aerosol droplets into the environment, infecting nearby animals and surfaces, like food and water bowls. Dogs infected with distemper virus will develop watery to pus-like discharge from their eyes, fever, nasal discharge, coughing, lethargy, reduced appetite, and vomiting. As the virus attacks the nervous system, infected dogs develop circling behavior, head tilt, muscle twitches, convulsions with jaw-chewing movements and salivation, chewing gum fits, seizures, and partial or complete paralysis. The virus may also cause the foot pads to thicken and harden, leading to its nickname, hard pad disease. Dogs that recover from the disease are often left with persistent nervous muscular twitches and recurrent, repeated, seizures. Unfortunately, there is no cure for canine distemper, or any direct treatment for the virus that causes it. Instead, treatment aims at supporting the body while the immune system kills the virus. The only effective way to protect your dog from canine distemper is to keep their vaccinations up to date. Number 1. Canine parvovirus infection. Canine parvovirus infection is an acute viral disease in dogs characterized by severe enteritis, bloody diarrhea, vomiting, and dehydration. It is a highly contagious virus that affects dogs, mostly puppies up to 1 year of age. It is a particularly deadly disease in young puppies with up to an 80% to 91% fatality rate. Parvovirus spreads through body fluids, including in a dog's feces and vomit. It is extremely hardy and can survive in the environment outside the body for at least 6 months, and possibly much longer. Your dog can even contract parvo by sniffing another dog's poo, and it's not uncommon for dogs to catch parvo when out for a walk. Parvo can also be spread on shoes, clothing, and human hands. The cornerstone of treatment is supportive care. Ideally, this involves hospitalization and intensive nursing care. Similar to other viruses, parvovirus has no cure. Antibiotics are given to prevent sepsis. Fluid therapy and other supportive treatments are also necessary to aid dehydration. Parvo is a devastating disease that is preventable with the correct vaccination series. Ensure that your puppy receives all of their parvo vaccines before you take them for a walk or let them socialize with other dogs. If you have other dogs in the household, make sure that they are vaccinated against parvo as well.